I was a nurse in the hospital. I worked in the postpartum unit, which is where you are after you have the baby, but before you go home. And I had a couple ask me, can you just come home with us? We're not ready. And I said, oh, you'll be fine. It'll be great. Later that week, another couple asked the same exact thing. And then there was a third one. Literally in the same week, 3 couples asked if I could come home with them. That was my aha moment. Like, wow, it really is scary for a lot of people. They don't feel prepared and they just want a little extra support and help. Hi, my name is Danika Frandsen. I'm the founder of Baby Steps Concierge Nursing. So we help first-time parents. We can help repeating parents as well. Actually, integrating a second baby into your family can sometimes be a challenge. We often help LGBTQ parents who have used surrogacy to build their families. That is a long, exhausting journey, and there's a lot of hand-holding that happens for all families during the pregnancy that tends to disappear as soon as the baby's born. In Australia, I know that they send a nurse to your home for a few weeks after so that they can check in and see how things are going. So there's a lot of other countries that are doing more than we are doing. And as a nurse who actually is in the hospitals, I can verify that we are understaffed, we are overworked, and our healthcare system just really isn't as efficient as it could be. We offer education before the baby comes. We offer hands-on practice. We have nurses that'll come visit you in your home and help out and troubleshoot with things at home. We offer phone support. We offer Zoom support. We're the only company that employs registered nurses exclusively. So as registered nurses, we have licenses we have to keep up. We have continuing education we have to do. We are up on the latest evidence-based practice. Our process, I think, encompasses everything. So we address the mental, the physical, and the emotional part of being a parent. The mental aspect is the first step, and that happens before the baby's born, typically during the 3rd trimester. And we have some conversations. We have conversations about expectations, not only as a parent, but the logistics of having a newborn in your house. Do you have pets you have to worry about? Do you work from home? How is that gonna look with a newborn that needs to be fed every few hours? So having that conversation on what to expect can start easing some of those fears. The second step is the physical, where we'll do some hands-on training, how to pick up the baby, how to swaddle the baby, how to bathe the baby. Some of those basic skills that people just kind of assume everyone knows how to do, but can be very, very scary, especially if your baby's born a little early and is tiny. And then the third step is what I call the emotional. And that is the after coming home with your baby and the exhaustion and the excitement and all of it together is when it can really be hard to actually integrate that new baby into your lifestyle. We like to give you your first night at home alone so that you can start bonding and kind of see how things are going. And then we can spend anywhere from a couple hours a day, a couple times a week to however you need it organized. We've encountered such issues as giving the first bath. The baby's first bath is usually given in the hospital, but your first bath at home is very scary. They're very slippery, they're very little. So being there to be able to help with showing you the best way to do it, how to do it confidently and safely for the baby as well. We've also troubleshooted issues before. I had a family whose baby was eating fine and then a couple weeks in just stopped eating altogether. So she panicked, she called, we came over, and it actually was just an issue of using the wrong size nipple in the bottle. So it's something that we were able to fix quickly, but then again, the education part of it, showing her what to look for the next time, how to know when he needs a new one the next time, or when should you call the doctor versus when is it just an issue of something like this. Everyone says you need a driver's license to drive a car, but you don't need a parenting license to be a parent. So we created a parenting license. For those of our clients that go through our program, you will get a parenting license at the end. I want there to be awareness that there is this gap, and I want newborn education and new parent transition support to become a standard part of healthcare. So if you're wanting to ensure a smooth transition to parenthood, reach out to book a call. We're looking forward to hearing from you.